Hey guys, Tony Maritato here, physical therapist. I'm back in the clinic today, and I told you I was going to share some videos using the 10-7000 device to help reduce pain while working on knee mobility. Now, a lot of my patients, you've seen the videos, some of them will come in with 90 degrees of flexion in the first couple days after total knee replacement. That is amazing, but that is not the standard result. Most patients will struggle to get to 90 degrees for as long as 4 weeks. Some people don't even get to 90 degrees 12 weeks. Everybody's going to be different. Your body is going to heal at its own pace. I'm going to say almost nothing you can do is going to change that. You can always make it harder for your body to heal. It's hard to really make it faster or speed up the healing process. You can sleep better, eat better, do the things that, are just generally healthy. But one of the things we're talking about today is pain management, conservative pain management, non-pharmaceutical pain management when we're working on bending the knee. So a lot of people will use some version of a recumbent bike, a stationary bike, when they're trying to bend the knee. You can see here that as the knee comes around, that ankle comes back. This is usually where we start to feel either the pain on the inside medial portion of the knee. Some people will get discomfort across. They'll say it's like a thick band or like duct tape wrapped around it. What the TENS unit does is it provides altered sensation. So we've already attached the wires to the leads. There is no one size fits all when we're talking about where the pads go. What I'm going to do is I'm going to do this a little different. I'm going to put one black lead below on the outside. I'm going to put the red lead from the same wire above on the inside. And then we're going to crisscross the other one. We're going to go black on the inside part of the leg down below. And we're going to go red on the outside part of the leg up above. I try to find areas where I've got good kind of muscle so that I'm not sitting on a bone. I want a little bit of fleshiness underneath where the pads are going. We've got a crisscross pattern right now, but sometimes I might run one wire up and down on the side, the other wire up and down on the side. You just need to experiment. You always want to keep the little plastic sheath because these are reusable pads. When you take them off, you put them back on the plastic sheath. They'll be ready for you to use next time. The way the 10-7000 works is you turn the knob, it clicks and beeps. That means it's on. I can see the number. Now, I preset mine to 15 minutes. You can control the settings, you can control the intensity, everything here with the up or down arrow, the set button, and the mode. For mode, I just leave it on normal. And what I'm looking for is, I start to turn up the number till I feel just the slightest little bit of tingling. For me, I know you guys can't see it from there. As soon as it hits the number 3, that's where I can start to feel it. And sometimes you feel it on one side, you don't feel it on the other, that's okay. Once I feel it just a little bit, I turn it up to a level of intensity that is what we would describe as strong but comfortable. I don't want the muscle to twitch. I don't want to see, we call it a fasciculation. I don't want to see anything going on. I just feel a strong, buzzy, tingly sensation. Then I'll do the other one. I don't worry if the two numbers are exactly the same. So like for me, I'm just barely over the 3. There's nothing here like numeric wise between a 3 and a 4. They're very close together. So I'm going to say anywhere around a 3, 3.2, something in that range. But I can feel a very strong sensation on the inner pad here. I feel a strong sensation on the lower pad here. I don't feel much. I feel a little bit on the 2 outer pads. And this is a good intensity. It's buzzy, tingly. The muscles aren't twitching, but it's definitely giving me something to feel. And now from this position, I just start to work that knee flexion. If you're unable to get a full revolution, that's okay. That's very normal. What I like to do is I like to work the lower portion, and then sometimes I'll bring it over the top. I'll work the upper portion. If you've had this, if you've had a total knee replacement, you've gone through the rehab, you know that a lot of times going backward is usually a little easier than going forward. A couple tricks, a couple little things that your therapist might have already told you. If you notice, we took the straps off the pedals. That's because I want to be able to sneak my foot further forward on the pedal. So that pedal is on the heel. The other pedal you can't see, but it's at the toe or the ball of the foot. And what that effectively does is it lets me get away with less flexion without moving the seat. Now, this seat is super easy to move. It clicks into place. I love this bike for the ease of moving the seat. But if I don't have a bike that's easy to move the seat, I just move the foot. When my foot is closer to the heel on the pedal, I have less knee flexion. As my foot slides back to the toe, I have a lot more knee flexion. So just with this little positioning, I can control how much knee bend or knee flexion I need. You can also do a little compensating. So some people will bend, lean away from the knee side that is tight. It's okay for a little bit, but we don't want to compensate that much. You can control the alignment. Some people will drop the knee out, open the hip up. This gives them a little bit of relief. Some people, we want to keep that knee nice and straight. Usually my rule of thumb is when the knee is up in the highest position, I want to be able to see the inside of that ankle. If my knee collapses in, I can't see the inside of the ankle, and that's not an ideal position for the hip, knee, and ankle. This would be knock-kneed. We don't want to put a brand new knee into this position. We want to keep the knee over really the second toe, the shin relatively straight. It could be a little wider than the hip or in line with the hip. It doesn't want to be inside the hip. And so typically we would work on this 15 minutes, the TENS unit's going to run. You can add ice on top of the TENS unit if it feels better. You can do a compression wrap. You can use a knee sleeve. There's a whole bunch of stuff you can use. But the bottom line is when I'm looking for an alternative, a non-pharmaceutical way to reduce pain and allow me to work on flexion, this is absolutely one of my favorite. When I finish, I turn the knobs. They will click. The device will turn off. I'll grab the little plastic. I stick my electrodes back on. Hopefully I leave some hair on my legs. But basically, what I would do is just like you saw when I brought the TENS unit over here in the beginning, I would just leave everything attached. You know, my leads stay connected. The pads are on the plastic. The TENS unit is off. I close the lid. And I just go, I'm going to stick this in a drawer on a shelf somewhere where it's out of the way for the next time that I'm going to use it. But these little guys are affordable. They're super durable. This is my favorite of the models, but it doesn't matter which model you use. Find the one that works for you. If you have more questions, you need more information, let me know in the comments. I'll see you guys on the next video.